So hello student, I have been working in this field of medical coding for the last 10 years and I have decided to conduct this course online free for every students who are planning to take the CPC exam. This course will have the CPT preparation, ICD preparation, anatomy and the medical terminology that is required for this particular course. This course will have a lot of questions, question papers related to this field, which will help you for the preparation of the CPC exam. So you don't have to take any courses, and this course will be absolutely free, and definitely it will help you for the preparation. We will begin with the CPT. I will teach you how to navigate the book CPT and how to go about this book. So let us first understand what is CPT code for. The current procedural terminology is the full form of CPT. These codes offer doctors and the healthcare professionals a uniform language for coding medical services and procedures to streamline reporting, increase accuracy, and efficiency. CPT code are also used for administrative management purposes such as claim processing and developing guidelines for medical care review. So one must remember that we use the ICD code for the diagnosis and the CPT code for the procedure and medical services. So let us have the walkthrough through the coding manual, CPT coding manual. It has a CPT section, the section guidelines, section table of content, then the introduction to category 2 codes, category 3 code, appendices and alphabetical index. So we are going to see one by one how does the CPT code book looks like. So if you see the CPT code book, the code book has the year of that CPT code book it is written, and it has the color coding. The color coding indicates the different section that we see in the CPT code book. This code book is edited by the American Medical Association. So we have it is written as a AMA. Of course, this color coding is obvious in professional edition of the CPT code book. So let us understand the content of this book. There is an introduction to few topics, and then you can see the various topics: the evaluation and management, surgery guideline, surgery, radiology, pathology. And in the introduction, the topics which are very important for us is to understanding what is the time and then the place of service code which they are and the modifier. So we are going to see one by one. So the front cover of the CPT Professional Edition, it talks about the various symbol. They are the part of this particular code book, and then they have mentioned all the modifiers here. And of course, these are the level 1 modifier. So here there is a mention of the word level 1 CPT modifier. And then we have the level 2 modifier, which are called as a HECPEX modifier. So these modifiers are mentioned in the on the front page of the CPT. The place of service code for the professional claim. Listed below are the place of service code and their description. This code should be used on professional claim to specify the entity where the service was rendered, and we this place of service codes are important because nowadays in the CPC exam they do ask the place of service code. So if you see here closely, the place of service codes are given and the place of service names are given. So whenever the service is given into the office, the place of service code for that is 11. So this is very important. So you should just go through it. And of course, remember the CPC exam is an open book exam. So you're going to have all these things in front of you, but you must remember where to look for it. So in the beginning, we saw that there was a professional edition and the year was written. Now, why is it important? Because every year on 1st of Jan, the new CPT book comes into the market. And as a coder, we always refer to the latest edition that has the latest guidelines and the latest new code. So you will see that the category 1 and 2, these two codes comes into the market, or effective timeline is January 1. And this is very important. Sometime during the interview, they do ask that what is the time when the new CPT book comes into the market. Now you will see that the CPT code set includes three categories of medical nomenclature and description. They are the category 1 code, category 2 code and category 3 codes. So let us understand what is the category 1 codes mean. The category 1 codes, they are where most of the codes live. These codes are 5-digit numeric code. So for example, 1, 2, 3, 4, 5. So if you see the difference between the ICD and CPT, in ICD code, after the three numericals or the three numbers, you will always find a decimal point, which is not present in the CPT code. Now there are over 7,000 service codes plus titles and modifier which are included in this 90,000 CPT codes, and they are reviewed and updated annually, and it is mandatory to use this code to report the services and reimbursement. These codes are used to report procedures, services, drugs, including the vaccines. Now let us look at the category 2 CPT codes. Now the category 2 CPT codes are alphanumeric in format. What do you mean by alphanumeric? That means they consist of the alphabet as well as the number. So if you see the category 2 code, they have the letter F, and the letter F is in the last position. So if you see the category 2 code, they look somewhat like this. So this is the list of the category 2 code. Where do we use the category 2 code? They are basically for the optional performance measurement tracking codes, and they are physician quality reporting system codes. And remember, whenever we are using category 2 code, we always use the category 1 code along with the category 2 code. So the category 2 codes, we usually don't use it on the day-to-day basis, but it is must for you to know the category 2 code. Sometimes they do ask this question during the exam, but more or less this question is asked during the interview. Now the category 3 CPT codes, they are temporary codes. They are also alphanumeric in structure with the letter T in the last position. But all the category 1, category 2 and category 3, they are the 5-digit codes. But the category 1 is completely numeric, while the category 2 and category 3 are alphanumeric because it has the alphabet in the end. The category 2, which we saw earlier, it had a F in the end, while the category 3 has the T in the end. It can be reported alone without the additional category 1 code. And these codes are used to report the new and developing technology, procedures and services. So this is where we use the category 3 code, and they are there, or they are mentioned in your book also in the under the heading category 3 code, and you can just go through this particular theory which provides you the information of the category 3 code. Now let us understand the category 1 codes which are your bread and butter. So the category 1 code, they are the CPT, they are present in the CPT coding manuals, and they are divided into various categories. The 6 main sections for the category 1 codes are evaluation and management, anesthesiology, surgery, radiology, pathology and lab and medicine section. So there are 6 sections where the category 1 code are divided, and if you see in the bracket, you will see that there is a code range which is given, and that is applicable for that particular section. This is the table of content which is there at the beginning of the evaluation and management, which is your first section, and we use this table of content to solve many cases related to the evaluation and management. If you see the CPT book, it is divided into 6 sections, and then you have the appendices, and in the end you have the index. So if you see the sections, the section looks like this. So this is the surgery section, and there is a color coding here also which will talk about which section it is. Now under the surgery, there is a subheading integumentary system, and here the year of the book that is written, and here the code range which is present on this particular page is written, and this is the anesthesia section. Now let us move to the next thing, and that is the CPT index. Now we have seen in the ICD you will see that ICD book starts with the introduction, then there are guidelines, then you have the index, and then you have a tabular list. But as far as the CPT is concerned, you will see that there is an introduction, then there are various sections, then there is a alpha appendices, and at the end there is a CPT index. Now what is a CPT index? CPT index refers to the alphabetical listing within the CPT codebook. It acts as a search tool to help medical coders quickly locate the appropriate code for a specific medical procedure or service based on the keyword related to the body parts and procedure performed. So you will see that index always begin the alphabet A. The any index, whether it is a ICD or CPT, it pretty much resembles the English dictionary. So you will have all the procedures or the services or the body part begins with the letter A. Now here I have taken the snapshot of the letter B. So here you can see very clearly that various procedures, various body parts which are started with the letter B are under the alphabet B. Now in front of that you will see, like for example, in front of the bottle procedure I can see that there is one code. Sometime in front of that particular procedure there is a range of code. Now this is called as a range of code because it says 27455 to 27457, and sometime in front of the code you can see multiple code. For example, brachial plexus, anesthetic, and in front of that there are multiple codes written. So the way we follow the ICD here also, first of all, you will go into the index. After locating that particular term, we will find out whether there is a single code, whether there is a range of code, or whether there are multiple codes. We will pick up that code and go to particular section. Remember, the sections are arranged in the numerical order. So you will have first the 10,000 series, then 20,000, then 30,000, then 40,000, so on and so forth. So after the CPT sections, we have the CPT appendices. Now what is CPT appendix? In the CPT book, an appendix referred to as a separate section at the back of the medicine section that provide additional information and guidance on a specific aspect of coding, such as list of modifiers, specific coding situations, or details on new procedures, often including new codes, essentially acting as a supplementary guide for the medical coders. So appendices are nothing but the supplementary guide which they have incorporated into the CPT codebook. So in the previous slide, you have seen that there is a list of appendices, Appendix A to Appendix T, and every year whenever they feel, they keep adding an additional appendix. So let us look at the some important appendix that we may refer continuously from time to time. The first is Appendix A. This is a very important appendix. It talks about the modifier definition and listing. What is modifiers? They are the two character codes that provide additional information about the medical procedure, services, or supply. They are appended to a CPT code without changing its meaning. So these modifiers, they are basically the two character codes, and that we add to the CPT code. So we write the CPT code, and addition to that we write these two character codes to give some more information about that medical procedure. So how to use this modifier and when to use this modifier, that we learn it when we go ahead in this particular course. So let us look at the Appendix B. It is a summary of additions, deletion and revisions code. So whenever there is a new code, in front of the new code, we put the red dot, and if there is a code revision, that means if we have revised the language of the code, we put the triangle, the blue triangle in front of the code. So beside including them into the Appendix B, In the book also you will see that in front of that particular code we do write this particular symbol, so that the coder get aware that there was some revision of the code that has happened. Now this is the code 99203, and in front of that I will see this particular I can see this triangle. That means there is a revision of the code that has happened for this particular. This Appendix C is important because it talks about the clinical example of the ENM code. Now, Appendix C ENM code, this example help practices select the correct level of code and provide context for the descriptors. Appendix D, which is a very important appendix. Appendix D talks about the summary of the add-on codes. Now, whenever you are using the add-on code, these are the three important tips that one must remember, that whenever you are using the add-on code, you have to use the add-on code in addition to the primary code. Then add-on code can't be sequenced first, and you cannot use the modifier 51 and 50 to the add-on codes. Now if you see, the add-on code is symbolized by the plus sign in front of the code. So whenever I see the plus sign in front of the code, I know that this is the add-on code. So whenever I am writing the code 11103, I cannot write that code in the first place. I have to have the primary code. So for 11103, there is a primary code which is 11102. So whenever I am mentioning the code 11103, I have to write the code 11102, and then only I can write the code 11103. So it says these two first tip, that use in addition to the primary code and it can't be sequenced first. And then the use of the modifier 51 and 50. We can never use the modifier 50 and 51 on the add-on code. Here in my lecture, I am just taking those appendices which are very important. But as a coder, if you are navigating the code book for the first time, I would request to just flip through the pages and see all the appendices. Now Appendix E. The Appendix E, it talks about the summary of the CPT codes exempt from modifier 51. The circle with a slash symbol indicate that the code is exempt from the use of modifier 51, which is used to indicate that the multiple procedures have been performed. So you don't append a modifier 51. Appendix C is also very important. Look for the circle with a slash symbol, because if that symbol is present, then we can assure we are rest assured that we cannot use a modifier 51 on those codes. Now Appendix F is summary of CPT code exempt from modifier 63. So modifier 63 exempt code, uh, you have to, sometime there is a parenthetical note which clearly mention that don't use the modifier 63 on this code, or the modifier 63 is not appropriate for the code designated as modifier 63 exempt, or for the procedure which are involving the congenital anomalies or heightened complexity associated with a prematurity. Okay, so on those anyway we are not going to use the modifier 63 if the procedure is performed on infant less than 4 kg. Appendix K is for the product pending FDA approval, and it is always denoted by the symbol which is called as a lightning bolt symbol. Usually you will see this symbol in front of the vaccine code. So here you can see that there is an influenza virus vaccine code, and in front of that I can see this symbol. Now, what do you mean by product pending FDA approval? Whenever the new vaccine comes into the market, the vaccine remains under trial for certain amount of time or certain amount of period. And after particular period passes, then it gets complete FDA approval. So till that time, the vaccine is under trial, and that can be noted by the lightning bolt symbol in front of the code. Appendix L is a very important appendix. It talks about various vascular branches and the various vascular families related to the arteries and veins. We use this appendix extensively for the cardiac catheterization procedure. in this particular appendix, they have mentioned the first order branch, the second order branch, third order branch. And again, in the professional edition, they have used the color coding. So the color red denotes all the vascular vessels above the diaphragm, and the color blue denotes all the vessels below the diaphragm. This is a very important appendix. When we go to the CPT cardiology, I will talk more detail about this appendix. This is Appendix M. It talks about renumbered CPT code citation crosswalk. So remember, every year, depending upon the requirement, the CPT keeps on adding new appendices. On this slide, you can make out that there is Appendix S, which talks about artificial intelligence taxonomy for medical services and procedure. And artificial intelligence is fairly new field, and its incorporation in medical services also evolved over time. So whenever there is a new technology, whenever there is a new addition into the field of medicine, that can be introduced to the CPT in the form of appendix and later on in the form of codes. Now let us talk about the various symbols which are there in the CPT. You will see that all these symbols are listed at the bottom of every CPT page. It provides coding guidelines and instruction. So at the bottom of every CPT page, you will see this symbol. There is a star sign, and in front of that, what is the meaning of that sign is written. So we are going to see all this sign one by one. So let us start with the first sign, that is a number and a hashtag. Okay, in the CPT code book, a hashtag indicates that the code is listed out of numerical sequence. Now, as I told you that the CPT code book is arranged in the numerical sequence. So here we have the code 15851. Now, after the code 15851, because the book is in the numerical sequence, we should have the code 15852. But the code what we see is a 15853 and 15854. So these two codes are not in the numerical sequence, but they are out of numerical sequence, and I can see the hashtag which is written in front of that code, and that's why this particular sign talks about that out of numerical sequence. Now the two triangle facing each other, that means there is a new or revised information about the code. The green, red, blue dot with arrow, it looks somewhat like this, and it is symbolized by the three different color. It is the American Medical Association published additional information about the code. Now the telemedicine code, it is symbolized by the star. It refers to the online digital evaluation and management services for established patient. Now here you will see the code 99417 and 99418, and I can see that there is a star sign. I can also see that there is a hashtag. That means this particular code will be out of numerical sequence, and this particular code is also telemedicine code. Whenever more than one symbol is present in front of the code, one needs to apply all the symbols. So we have seen in the previous page or here also that there is a code 99417, and in front of that there is a hashtag, there is a star, then I can see already the plus sign, and then there is a red dot. Now when I have to read all this sign, I will say that this particular code is out of numerical sequence, it is a telemedicine code, it is a add-on code, and it is a new code. So you have to apply all these symbols whenever you are reading that particular code. Now this is a very important concept as far as the CPT book is concerned, so I want all of you to pay attention. Now there is a two concept of the standalone code and indented code. What do you mean by standalone code? The standalone code is that which does not depends on another code for its meaning. What does it mean? So here the code 20100, it is called as a standalone code. Why? Because what does it say? It talks exploration of penetrating wound, neck. Now we will talk about the indented code. So the code 20101, 20102 and 20103, these are called as the indented code. What is the definition of the indented code? The code takes its meaning from the parent code. So what do you mean by takes its meaning from the parent code? So if you see the code 20101, in front of that, the word written is chest. So do I read the code chest? No, because it is a indented code, I am going to read the above code till the semicolon. So semicolon helps to distinguish each code. A common portion language, a language before the semicolon shared by all the codes in the family. So this particular group is called as a family. So when I have to read the code 20101, I am going to read the above code exploration of the penetrating wood. This is a common language because I can see the semicolon here. So if I have to read the code 20101, I will read exploration of penetrating wound chest. 20102 is exploration of penetrating wound abdomen, flank and back. I will give you one more important tip. Whenever it is an indented code and if you see the first alphabet, it is always in the small case. That should give you the clue that this is an indented code. So let us take two more examples for you to understand the standalone and indented code. It says 10060 is a standalone code because it talks incision and drainage of the abscess, and in the bracket they have given the various example: carbuncle, cutaneous and subcutaneous, abscess, cyst, furuncle and paronychia, and I can see the semicolon very clearly here. Okay, and then the code reads simple and single. Now see the code 10061. It says the word complicated and multiple. Can you see the first letter? It is the first word is always letter is always in the small case, and that is C. So when I have to read the code 10061, I will read the previous code from incision to this semicolon, and then I'm going to use the word complicated and multiple. The same way we will apply for 10080 because which is a parent code or a standalone code. It talks about incision and drainage of the pilonidal cyst, simple, and I can see the semicolon. Okay, and if it is a 10081, it says complicated. So I'll be using the common language incision and drainage of the pilonidal cyst, complicated, for the code 10081. So there are three different guidelines we'll come across in the CPT book: the parenthetical guidelines, very important one, section specific guideline, and then the general guidelines. So the general guidelines are at the beginning of that particular section. Like here, you will see that there are surgery guidelines which are always shown in the green page in the professional edition, and these guidelines are applicable to all the codes in the surgery chapter. Now then there are specific guidelines. These specific guidelines are section specific. These guidelines could be directly before the series of the codes or at the beginning of the section. So for example, I would call them as a topic specific because at the beginning of every topic you will see certain guideline related to that topic. For example, the biopsy related guideline. The biopsy is the subheading or the subsection of the integumentary surgery section, and in that you have the biopsy heading, and before starting the biopsy code here you will see the guidelines only related to that biopsy. So I would call it as a very topic specific. uh, Now, the third important is the parenthetical guidelines. They are the highest level of importance. They provide instruction on how to accurately report a medical procedure or other service. These notes are in a parenthesis and can be found after the code listing or within the code descriptor. So, for example, if this is the code 19300, below that there is a parenthesis and there is a certain guidance which is written. What is this guidance? They have said that the code 19300, it is a mastectomy, that is removal of the breast for the gynecomastia. For the gynecomastia is basically the enlargement of the breast in the male. And if they have done the mastectomy for that, I can use the code 19300. But if there is a breast tissue removal or the breast side reduction for other than gynecomastia, that means if the same thing as done for the female breast or not for the gynecomastia cases, then I have to use the code 19318. So this is a very important information for me. So in this case, if the mastectomy is for the breast reduction, I cannot use the code 19300 because it is mainly for the gynecomastia. So I need to read this code, apply them, and when I apply these guidelines, I will choose the right kind of code. Now the last and important slide, it is sequencing of the code. So many a time you will see that for a given patient we end up writing many CPT code. The way we end up writing many ICD code, we end up writing many CPT code. So whenever there are multiple CPT code, how do we sequence them? So there is a rule that most complex procedure always gets sequenced first. How do we know what is the most complex? So by the RVU. RVU stand for relative value unit. The higher the RVU, more complex the procedure it is. So it is as simple as that, that a more complex procedure will have a higher RVU and simple procedure will have a lesser RVU. Typically, the codes with a higher RVU appear first and then the lower RVUs in the CPT code. Example, intermediate repair is coded first and then the simple repair.